There's so much work to be done in the area of mental health and women's mental health. The mind's eye of a person who, for instance, is delusional, they don't choose to engage in that delusion. They don't choose to become psychotic. It's a chemical imbalance that needs to be addressed. And in the issue of women's mental health and postpartum, certainly when a mother reaches a stage where she becomes severely depressed, it becomes a medical emergency. The last couple of legislature sessions, we proposed not only a change in the insanity standard, but the last time down, we inartfully, if you will, crafted a bill, and we called it infanticide. And I think that this time down, we will present a bill that will incorporate postpartum into our penal code, and to have, if certain criteria are met, have mothers judged by juries who hear evidence that doctors have determined is credible. And recently, when the healthcare initiative became law, attached to it was the Melanie Stokes, the Mothers Act. And it calls for money into research. It calls for education in the medical community, encourages screening of new mothers for signs of postpartum. And I don't know why we can't really do that on a state level as well.
I was not overly educated on postpartum illnesses prior to Andrea's case coming into our lives. Since then, in hindsight, I can probably say people I know, people that are related to me, suffered from these illnesses and screamed in the dark and no one heard them. We fix the moms, you fix the children. I mean, it seems like simple math to me. And so anyway, our thinking was together that these 5 children could not have died in vain. Their lives, their memories have to go on. We realized how ill-informed everybody was regarding postpartum illnesses. I know there had been people screaming and shouting long before we got into the picture, but where our hearts were with these 5 children, and that their memories live on, and that this tragedy does not occur again. Anybody that suffers from any type of mental illness, be it postpartum or anything that's lifelong, I mean, these are still contributing members of society. I mean, we don't just treat an illness, but we create a life for somebody. And postpartum in particular, people have to know this doesn't necessarily have to be a lifelong. This can be a very short-term period of time where a mom is going through a depression and she can come out of it. I just hope that people stop shunning and the stigma of all these issues will eventually wilt away. That's what I hope.
For more information or to get involved in women's mental health, contact Mental Health America of Greater Houston at 713-523-8963.